The NHS is being told to look after its workers better after a report out today revealed that 45,000 health service staff call in sick every day, costing the taxpayer billions. The study also suggests that patient care is suffering as a result. Well, joining us now is Stephanie Thomas. She's from UNISON. Hello, Stephanie. Looking at the average numbers of days taken off a year, within the NHS it's 10.7. In other areas of the public sector it's 9.7, compared to in the private sector it's just 6.4 days on average taken off annually. Why is it so much higher?
It's higher because you can't really compare the NHS with the private sector. It's like comparing apples and pears. They're so totally different organisations. And what you've got to remember is this report doesn't say why people are taking the sickness absence. And it doesn't reflect the fact that last year 56,000 NHS staff were attacked by the patients or members of the families.
But don't we need to know about things like this? Don't NHS workers have to be just as accountable as other people who work for the public sector and people in the private sector when they are taking sick days off? We need to know, don't we? We
do need to know, but there's a responsibility on the employer to deal with the issues that are causing the day's sickness. We know from our own research and from the research that came to compile the report that sickness is due to stress at work, mental health issues, musculoskeletal injuries, and the bulk of the sickness is related to accidents at work. And we've known this for a very long time.
50% down to musculoskeletal, 50%, so the bulk of it can't be down to accidents at work.
The bulk of the sickness in the NHS is down to accidents at work or assaults at work. It's not down to people ringing in saying, oh, fancy day out.
But if 50% is from muscular injuries or skeletal injuries, then that can't be accidents at work, can it?
Well, some of it is accidents at work where people have not had the training to manually lift patients. And also, if you think about the issues that face NHS workers every day, this covers not just people who work in hospitals, it's frontline ambulance staff, it's people who actually work out in the community, who are subject to regular assaults. And if you actually break down the figures, it does actually lean you to believe that these are accidents at work which are causing the bulk of the sickness. So we've said for a while we need better procedures in place for reporting incidents, better follow-up care, better rehabilitation, quicker access to physiotherapy and quicker access to services to get people back doing the job they want to do.
One of the solutions that UNISON has suggested, though, is, for instance, better canteens for staff, better opportunities to take exercise. Do you not think that people are going to think, well, why should people in the NHS be spoon-fed more than people in the private sector? We can't complain about how we're nourished at work. It's not up to our employer.
The problem that you have, there is a distinct difference between people who are working in the NHS, work 24 hours 7, delivering quality care. And if they're not well, the care gets affected. If you have, for example, a member of staff on a frontline ambulance who gets a call to go out to see a patient in the middle of their meal break, they have to go. They don't get fed on a regular basis. If they're due to finish the shift at 2 minutes to 7 in the morning and a call comes in, they have to go on that call, which extends the time that they're at work. There are also all the research shows you that if you work shifts, you have irregular eating patterns. And UNISON is saying, yes, we need to improve the health and well-being of staff so that can actually improve the care of patients. We're not saying that the report is incorrect, but I think what we do have to establish is that the NHS is a different beast to other private companies, and it's an unfair comparison.
But at the same time, the NHS has to be made accountable, just like other companies.
It has to be accountable, yes, but also deliver care.
Thanks, Stephanie.